The examination of all surfaces of the tooth for carious lesions is an important observation that must be made before starting a crown preparation. If present, their extent must be determined and plans formulated for treatment prior to initiating the crown preparation. The caries must be carefully excavated, the remaining tooth structure evaluated, and further treatment of the lesion determined. The amount of remaining tooth structure and its condition are the most important factors in selecting the treatment method of choice. Treatment may consist of several options. The excavation may be refined and made an integral part of the crown preparation. Such excavations may be used to provide additional resistance and retention for the crown. The decay may be excavated with placement of glass ionomer cement in the excavation. Lost tooth structure may be restored with direct restorative material, and the tooth subsequently prepared for a crown. The tooth may be restored with a pin-retained amalgam. Pin placement must be such that the pin will remain after the tooth is prepared for a crown. The most extensively involved teeth may require endodontic treatment and the placement of a post-core buildup. In many cases, the shallow depressions left after excavating small carious lesions are obliterated by the routine removal of tooth structure during the crown preparation. Any small undercut remaining after the crown preparation is completed can be blocked out with glass ionomer cement before the impression is made, or blocked out later on the die with compound material before the crown is fabricated.
It is important to recall that the purpose of the post is to retain the core buildup. If sufficient tooth structure remains to retain the core after endodontic treatment and caries removal, a post may not be necessary. The insertion of grooves and boxes associated with caries removal may be used to enhance retention and resistance for It is advisable in these cases to prepare the tooth ideally when possible, then subsequently remove the caries and prepare the retentive modifications. Extensive excavations and full contour restorations are best performed prior to crown preparation. In this manner, they are generally easier to restore, and permit the operator to prepare diagnostic casts, reduction guides, and matrices for fabrication of a provisional restoration. If the tooth is restored to full contour prior to crown preparation, the operator has a better opportunity to visualize and prepare the ideal crown outline for